Hello everyone, thank you for registering for the Unlock the Power of Ayurveda to Relieve Your Joint Pain webinar. My name is Sonika and I'm pleased to introduce our esteemed guest, Dr. Keshav Chauhan. Dr. Chauhan is a highly qualified and experienced Ayurvedic physician with a BMS degree. He learned the traditional Ayurvedic skills under the mentorship of Dr. Pratap Chauhan for 5 years. Currently, he is working at Jiva Ayurveda, an organization with a mission to revive the Vedic Indian science of healing and make it accessible to people all around the world. This webinar is brought to you by Alternative Health. Just a little bit about Alternative Health is that it is the first telemedicine portal dedicated to complementary and alternative medicine. With more than 38% of the US population and over 50% of the world's population use alternative therapies, and such a high demand is there for this platform. And luckily, Alternative Health is what has come to rescue for people who are seeking for alternative solutions. We are a platform that provides its subscribers 24 by 7 access to therapies and professionals online, and which is the perfect hub for alternative medicine. So during this webinar, Dr. Chauhan will share his valuable insights about the causes, symptoms, diagnosis, and the treatment for joint pains. Our goal is to help you live a life free of high-dose medication, which usually has side effects. With Dr. Chauhan's guidance, you will learn how Ayurveda can help you eliminate the need for such medications and cure joint pains. During this session, if you have any questions that you would like the doctor to answer, please use the Q&A tab to input your questions, for which the doctor will answer at the end of the session. Thank you, and over to you, Dr. Chauhan.
Thank you very much, Sonika, and I welcome all the participants, and I'm happy to see people's interest to manage their joint pain with Ayurveda. So Ayurveda has been, giving solutions to joint pain for thousands of years, and we at Jiva have been working for more than 30 years now, and giving significant relief and complete cure in many cases of joint pain. So first we'll understand what is joint pain, how it manifests, and how Ayurveda looks into it. So the management of joint pain is completely different in modern medicine, and from the perspective Ayurveda looks into it is more holistic and will involve other involvement of other body tissues and even mind and digestion and other activities that lead to a healthy joint condition. So mostly we have seen that in modern medicine the treatment is limited or restricted only to the specific joint, right? Either as a painkiller or maybe as a surgery or maybe some other devices or tools or some additional equipments that might help in getting some relief from the joint pain. But it is not still holistic. They're not looking at the cause behind it. You might fix the things, you might fix the anatomical changes by doing the surgery, but the same condition can reoccur again if the cause behind it has not been fixed, or we are not working to really strengthen and nourish the joint from a holistic perspective. So with this, maybe we'll start the presentation. So Sonika, can you please come to the next slide? Yeah, so I'll start with this question. How many of you have experienced joint pain in your life? So maybe you can drop your message in the chat if possible. Or so I'm sure if you have joined this webinar, most might be suffering from joint pain or have joined for your family or friends or somebody who is suffering from joint pain. So if you see the stats, maybe next slide, please. So the stats are quite alarming, and there is a big prevalence of joint pain, and because so we are talking to US people today. So around 1 in 4 US adult have doctor diagnosed arthritis. So it's quite a big number, you know. If every fourth person is suffering from arthritis, and mostly we see that it is more prevalent in females, and females do get arthritis earlier than males. Usually post menopause, they start to develop some joint related issues, and 70% women over 65 years have arthritis. So it is doctor diagnosed arthritis, and the rest could also be suffering from some kind of joint pains. And this prevalence is expected to rise by 2040 by another 3 or 4%. So this is also a leading cause of work related disability, and adults with arthritis have, you know, they are 2.5 times more likely to have falls or injuries. So this is what I see in my practice. People who are above 50, they, in, you know, in their regular movements, they do get frequent jerks, they are tend to fall, or they have, you know, some frequent injuries which even aggravate their joint pain conditions. So this is some alarming stat, and we need to look for solutions. And Ayurveda provides wonderful solutions to manage joint pain. So maybe next slide, please, Sonika. So first, you have to understand what is a joint. So by the word itself, we know that there is some union of a few things there, right? So in a joint, there are definitely two bones come together to form a joint, but there are some other important structures as well, which lead to a good health of the joint, good movement of the joint. So one of them is the cartilage, which gives a protection to the joint. And while there is a movement of the joints, it prevents excessive friction and also gives strength to the joints. So it is a very important structure. And we do see the damage of cartilage in a lot of joint pain conditions, especially long running arthritis. There is also a fluid in between these two joints, which is called as synovial fluid. So this fluid is also nourishing the joint, keeping its health intact, prevents the degeneration of the joint, and also it is also helping in easy movements. So this is what we see in arthritis condition or joint pain condition in old age, that this fluid starts drying up. And as the fluid starts drying up, the pain aggravates, the movement of the joint is also restricted. Then there are some ligaments that help to connect the joints together. So you can see the joint are not connected by the bone to bone connection. They are connected through the ligaments. So these ligaments are making a capsule with the joints, and they help in the movement of the joints. So this is how the joint structure is. And while we take care of the joint, we have to take care of all these structures, and we have to also work on rejuvenation of this structure so that we can prevent the degeneration. Because once degeneration happens, then it becomes again very difficult to manage or reverse joint pains. Next slide, please. So now, what causes joint pain? So we know a lot of causes from the modern medicine perspective, but from Ayurveda, we'll go a little beyond, more deep into understanding this cause. Because until you understand the cause, it is very difficult to completely fix the problem. So this is what we have seen in Ayurveda, that we are not just working to manage the joint pain, we are also working to fix the cause behind it. Because, you know, we don't have very strong painkillers like you have in modern science, because we are not giving painkillers. This is how Ayurveda philosophy works. It is not focused on giving the painkiller, it is more focused on removing the pain. Why there is pain, you know, that has to be fixed. Okay, I'll give you a simple example. For example, if you are using a bicycle, and the tire is punctured, and there is a nail inside the tire, but you don't remove the nail. You fill in some air in it, and then you are using the cycle. Once the air is completely diffused, then again you fill in the air and use your bicycle. So this is how the painkiller works. We are just managing the pain and not working on the cause behind it. So we are not really removing the nail from the tire. And this is what we try to achieve with Ayurveda, that we remove the cause so that the painkiller is not needed. You are not just subsiding or eliminating the presence of pain, but also eliminating the cause which is resulting into the pain. Next slide, please. So there are three main causes of joint pain that we can broadly categorize in Ayurveda. First one is degeneration, so which is primarily caused by Vata. So when we talk about Ayurvedic management, we'll use this term Vata a lot. So there are three humors or three doshas in the body, which we call as Vata, Pitta, and Kapha. So Vata, Pitta, and Kapha are primarily responsible for all the physiological functions of the body. And when they're not in balance, they also lead to pathological conditions and diseases. So Vata is one of this energy, which we can say is a transformation of air and space element in the body. Okay, so air and space element in the body is Vata. So when this Vata is very high, which is air and space, when it gets aggravated, it will result into degeneration of the joints. Okay, why this Vata gets aggravated? It could be because of the wrong diet. It could be because of wrong lifestyle. It could be because of the place you're living in. For example, the area you live in is very cold and windy, and the climate is always on the colder side. So the climate will also lead to aggravation of Vata. Or you have a Vata Prakriti, which is another interesting concept in Ayurveda, that by nature you have more Vata in the body. So every individual, according to Ayurveda, is different. Every individual has a different body type. And so some people might get joint pain early in their life as compared to others. It could be because of their body type and their Prakriti, which is their nature. So this is an important concept to understand while we talk about management of pain in the body or in the joints. So pain is usually associated with this dosha Vata. Second is presence of toxins, which could be in form of ama. Ama is undigested food, or pitta. Pitta means more acid in the body, right? So such kind of pains are more inflammatory in nature. So they might not result into degeneration in the early stages, but they just cause some pain, stiffness, movement restrictions, and then later they become chronic and could lead to degeneration as well. So these are more associated with the digestion or improper digestion, or any other past disease in the body, which is resulting into production of toxins. Third is trauma. Trauma is also a major cause for joint pain conditions. Usually the injuries could result into damage of the joint or ligament. For example, ligament tear is a very, very common problem, especially in athletes and sportsmen. So trauma mostly associated in athletics or sports, but still a big chunk of other people who are not in athletes and sports do get some traumatic injuries, which results into joint pain as well. Next slide, please. So now you have to understand what is the cause of my joint pain, and then the management of that joint pain will start, right? So whether it is a toxin related joint pain, whether it is a degenerative joint pain, or it is a mixture of both, or it is a trauma related joint pain. So the cause is different and the management will be different. We will not be taking just painkillers or some calcium supplements for all of them. the management will definitely vary. So, how to identify what kind of pain I have? So there are certain criteria that I have written. Some of them which you can easily interpret and try to route the cause. So, for example, if the pain is because of ama or pitta, pitta means more acid in the body. Ama is again due to prolonged indigestion, or when the food is not completely metabolized in the body, then it will result into ama formation. So such type of pain, it will aggravate on rest. So if you're more sedentary and not doing any exercise, then on rest, this pain will increase more. Usually, this pain starts in the younger age, less than 50. It can even start in 20s or 30s, and then stay for a very long time in the body. In some diagnosed conditions like rheumatoid arthritis or ankylosing spondylitis or any other autoimmune joint disorder, so such joint conditions are also linked with ama or pitta related toxins in the body. Okay. In these cases, we can find there is morning stiffness. So when the person wakes up in the morning, the body is very stiff, and it takes some time to get to become, to get normal joint movements. In some patients, this time could be more than 20 minutes, 30 minutes, or even more than 1 hour sometimes. So the more the time is, the more the stiffness stays, it indicates the more the toxins are, right? In such conditions, we can also find history of chronic acidity or any other chronic digestive disorder. Could be chronic constipation, could be IBS, not only digestive issues, but could be some other diseases, could be stress as well. So I see a lot of stress related joint pains nowadays, especially in youngsters. In most autoimmune disease of joints, the major cause is stress or some emotional trauma or some over anxiety or over work, over burnout at work. So the underlying cause could be in some other system which is leading to some formation of toxins and causing joint pain. Some other diseases like diabetes can also lead to joint pains. Obesity, which is a very, again, more than 40-50% cases of joint pain that we have in our clinics, they are obese or overweight. So weight management is very important for joint pain people, and overweight will definitely lead to poor joint health. Even thyroid and other systemic diseases may also lead to poor joint conditions. Next is degenerative changes. So degenerative changes are usually seen in old age people, maybe after 60 years, but sometimes early degeneration also happens. So if you are not taking proper nutrition or nutritious food that nourishes the joints, then the degeneration may start. If you are, as I said, if you have a vata prakriti, which means your by body type, you are vata. So those people also have early degeneration in the joints. Females after menopause, the calcium absorption is not very good in the joints and the degeneration sets in. So in such condition, we can see some cracking sound in the joints. So when there is cracking sounds, it means there is not enough fluid in the joints. The joints are degenerating, right? And such pain usually will aggravate on movement. Okay, like we studied the toxin related pain, it will aggravate on rest when you're not moving, and with exercise the person might feel good. But in degenerative changes, the movement will aggravate the pain. Okay, and if you are facing both the things, then there could be a toxin and a degeneration both, right? The next cause is post-trauma. So usually after injury or jerk or after trauma, this starts. Sometimes the injury could happen in old age, just while walking, or instant spontaneous movements can also lead to some jerks or injuries. It's not always related to sports, but in old age, people are more prone to injury related joint pains. So these are the main causes. So you have to now identify what is my cause of joint pain. So then it will be easier for you to manage it. Next slide, please. So some things that can make the pain worse. Okay, so if you have any of these associated conditions, then that should also be looked after. So first is weight. So as I just mentioned, weight is very, very important. And now, in Jiva Ayurveda, we have a special weight training and weight management program for people who are overweight and have joint pain. Okay. So we do manage the joint pain conditions with some herbs and other things. But at the same time, we are also motivating and advising weight loss management programs for the patients, and we have seen wonderful results. So as they start losing weight, the pain starts subsiding. So in Ayurveda, when we study the formation of the different body tissues, so the joints, they are formed after the fat tissue in the body. So if the fat is overnourished, if there is more than normal fat in the body, then the joint nourishment reduces. The joints are not able to get enough nutrition. So if you are overweight and if you don't have joint pain now, so you are still prone to get joint pain in future because your joints are not getting enough nutrition. So weight management is very important, even as a preventive care, right? Any chronic disease like diabetes can also make the pain worse because it will impact the healing. Wrong posture. So posture is very, very important. Uh, if you're young and if you're working, then try to maintain a good posture at work. Especially your spine should be straight. Usually, I see people work with bending. Their spine is not straight and it's more bent, and or they're lying in different postures on the table or on the couch or on the chair while they're working. And in old age, I see people watching a lot of television post retirement, and they're lying on the bed or the couch and watching TV all day to pass their time. So this is also done in wrong posture, right? So it's important to maintain a good posture during the day while you're at work, and also while you're at home, not to be in a wrong posture where your spine is compromised and is not straight, and also your joints are under stress or pressure. So even if you're sitting for a long time, always stand up after an hour and try to move for 5-7 minutes. Okay, because long stand sitting for 2-3 hours will also impact your blood circulation in the joints. The blood circulation is not very good, and it will also impact joint health. So it's important to give some break from work or your sitting postures and move and walk in between, right? Overstraining of joints and over rest both can make the joint pain worse or your joint conditions worse. So overstraining means pushing your body more than its capacity. Okay, so you have to also know the capacity and strength of my body and not to over push myself, right? Poor sleep. Sleep is very important, and timely sleep is very important to repair the joints, and because we are using joints throughout the day for different activities, so there is a lot of cellular damage that happens, and at the time of sleep, all this damage is being repaired by the body. So if you are not sleeping well, it will also lead to poor joint condition, right? So you see the broader spectrum Ayurveda looks at it, right? In modern medicine, we will not find doctors explaining us that you have to sleep well for a good joint health condition, but it's very important. Um, if you are having joint pain, you will start to observe that your sleep quality also is affected, right? And once your sleep quality gets better, the joint pain condition also have some relief, right? Stress is a factor which can aggravate any underlying disease in the body, and stress could be a cause of joint pain and could be a cause of aggravating joint pain as well. But mostly we see this in inflammatory joint pain conditions which are related to the toxins. Constipation, gas, and acidity. So this is a very important thing, very important factor. If the gut health is not good, then the joint are also very weak. So if there is constipation or IBS or gas, acidity, then the joint becomes weak. And we have seen in many joint pain conditions, if we are helping relieve the constipation, if the gut health is improved, then their joint pain condition also gets better. So especially in old age, people who are above 65, 70, mostly we are working on their gut while managing joint pains. So as their gut health is good, their gut health is restored, the joint pain is relieved. And but why it is also vice versa. If the gut health is bad, then the joint pain aggravates. So especially in a lot of people who have gases, we have seen that if there is a gas, then the joint pain aggravates immediately. Okay, because it is associated with vata dosha, what we've just discussed. Next slide, please. So vata is very important for joint pain conditions. So as I mentioned, that any movement that is happening in the body, it is because of this vata. And when the movement is not proper or movement is not normal, then it is also because of vata, because of vata aggravation. So I'll not go too much into detail. I just want to highlight this term vata. So whenever you're looking for Ayurvedic solution of joint pain, you'll always come across this term vata, because the doctor will suggest you the food according to vata, the lifestyle according to vata, and also the herbs and management according to vata. So I will not go in much details, and we'll move ahead now. So next slide, please. So 5 mistakes that people do which prevents timely relief in joint pain. One is taking painkillers for long time. So if you're taking painkiller for a long time, the body becomes habitual, and then without painkillers, some people, they don't feel relief in the joint pain, and it will again, if you are not taking painkillers and you start with Ayurvedic management directly, then the reversal of the joint pain is very quick. Keep delaying a visit to Ayurvedic doctor. It is also important to timely address it. And trying a lot of things by self at home, and without understanding the cause of the arthritis, and without getting an expert opinion. So I see a lot of people doing home management with joints, and also trying some remedies, different remedies they see online. Taking diet that should be rather avoided. It is also an important factor. For example, we advise people not to take yogurt if you have joint pain, but on the contrary, people are taking a lot of yogurt thinking that it will strengthen their joints. So this is just an example, but there are a lot of diet related recommendations which are given in Ayurveda, which could be aggravating your joint pain. Limiting their physical movement and wrong postures. So as the pain sets in, first thing people do is they limit their physical movement. Limiting physical movement is not always the right solution to manage joint pain. Again, discuss with the expert. Maybe you need more movement to manage the joint pain, or the right movements to manage joint pain. Okay. In a lot of knee pain condition, we advise strength training of the muscles to relieve joint pain. Okay. So it is important to understand whether I need rest or do I need more movement to manage my joint pain. Next slide, please. So 5 things that you should do early to prevent joint pain problems. Even if you already have joint pain, you should still start on with these things. And if you are not having, then it can be done as a preventive care. So first is a regular oiling. So oiling is very, very important, a very integral part of Ayurvedic advices and an integral part of our daily routine in India. So if you are doing regular oiling, it will strengthen the joint, improves blood circulation in the joints, reduces stiffness, and it prevents and delays degeneration. So it is very important. Just like we brush our teeth every day, oiling should be done every day in the joints, okay, without any break. That's how important, this is the importance of oiling to joints. So maybe if you're already feeling some discomfort in the joints, then you should start oiling now. Next is some diet which nourishes the joints. So also, nutrition is very, very important. I see a lot of people don't have enough nutrition for the joints in their foods. Okay, so there are certain foods which help in strengthening the joints, which I will discuss later in the slides. Next slide, please. Managing healthy weight, we have discussed about it. Very important to prevent joint pain. A regular exercise. So maybe some yoga, some stretching exercise, movement of all the joints. So even if you don't have time, it is very simple. Just give 10 to 15 minutes to your body every day. Circulate all your joints in clockwise and anti-clockwise direction, and do some stretching of the muscles. Okay, so muscles are also important in joint health, because the movements are done maximum by the muscles, right? So muscles are the one which help in the movement of the joint. So if your muscle strength is good, if your flexibility and contractibility of muscles is good, then it relieves a lot of stress from the joints. So it's important to do some muscle stretching every day along with some joint rotations. So these two exercises should be there. Maybe if you want to do some yoga and some other strength trainings, that can be done as well. Then the next is healthy digestion. So keep your vata and ama under check. If you have a very good digestion, then you're less prone to joint pains. And even if you get joint pain, you'll be able to overcome it earlier and faster compared to someone who is not having a good digestion. Next slide, please. So let's see how many of you put some effort in strengthening your joints. So maybe you can drop this in the chat if you're doing some efforts. Next slide, please. So how many of you do regular oil massage? Very important. It is a self-check, so you can see if you're doing or not. I'm sure it is something new for a lot of you, but it is very important and you should make a part of your daily routine. Next slide, please. How many of you do exercise or yoga regularly? Next slide. How many of you sit under sun every day? So exposure to sun is also very important, not only for vitamin D, but a lot of energy we get from the sun, which is good for your joints and also your back. Okay, so you should expose your joints and back to the sun. So if you don't get time on the regular days, at least on the weekends, try to put some oil on the body and try to take some sun bath. Very, very important and very, very essential for your joint health. Next slide, please. How many of you are not overweight? So if you are, then you should also work on managing your weight. Very important. Next. So now, how does Ayurveda manage joint pain? What is the holistic management in Ayurveda? So we identify the cause first. What is the cause? So there is a detailed history that we have to take with the patient. Sometimes it takes 20 to 30 minutes during Ayurvedic consultation, because we're trying to reach to the root cause of the problem. Then we create a personalized medicine, diet, and lifestyle plan. It is very important. So if there are 5 people with joint pain, all of them could have a different medicine and diet and lifestyle plan, because each individual is different, and there are 10 to 15 parameters of personalization in Ayurveda. Then we work on cleansing the ama, improving the digestion to enhance the better absorption of nutrition, lubrication of joints, and also removing the root cause of the joint pain. Step 3 is also panchakarma. Panchakarma is another practice in Ayurveda, where we do some therapies with the patients. The therapies are related with some massages, some quarterly sedation treatments, or some oil embarkments. So there are a lot of oiling, lubricating therapies and some cleansing therapies that we do through panchakarma, which help in restoring the normal condition of the joints, and also increases the unctuousness in the joints, which is very, very important for a joint pain condition. Next slide, please. So Panchkarma has a big role in the joint pain condition. So Panchkarma usually, it's not only a massage, but it includes a lot of therapies which we do in Ayurveda. So it helps in nourishing bones, muscles, and ligaments, helps in healings, fracture, or any damage done to the cartilage or any other joint, parts of the joints, improves flexibility, relieves pain. So pain relief is instant with Panchkarma. Immediately we see pain subsides, and the swelling, stiffness, burning, such symptoms also subside. Promotes lubrication and repair, opens minute channels, and also detoxifies body and enhances immunity. So for degenerative condition and toxin related condition, and even in trauma related conditions, we have wonderful effects with Panchakarma. And almost more than 70% of patients who have joint pain, they come to us and get Panchakarma therapies. Next slide, please. So this is just to highlight the success of Jiva treatment in joint pain. So we have, in last 3 years, we have consulted more than 300,000 patients. So, and you can see more than 90% patient had a good relief in their joint pain condition. Next slide, please. Some Jiva healthcare products for joints, which can be purchased over the counter. So I was talking about oil massage. So there is a pain relief oil which we have, which is a mixture of 5 different classical oil formulations, and this can be applied on the affected joint and used every day. There is also a pain calm pottery, which is a bolus of 11 different herbs, which can be used for sedation therapies after applying the oil. And then there is a supplement for pain management or strengthening the joints, which is a pain calm tablet, which is a fusion of more than 10 herbs, which are helpful in enhancing joint strength and also reducing inflammation in the joints. Next slide, please. So I was talking about some foods for healthy joints. So this is something which you can include in your diet. So as I mentioned, Vata is the main cause. So we'll prescribe some diet which help in balancing Vata. So these are Vata pacifying foods. So if you already have joint pain, then your food should be warm, unctuous, and liquid, which means you should avoid cold food, you should avoid frozen food, you should avoid gassy food, avoid dry foods. So such food items should be avoided. They can aggravate joint pain condition, right? So whatever we consume as a food will definitely affect our joints as well. So our joints are not completely, different from our body is made up from what we have eaten, right? So it is very important to fix this diet as well. So you cannot ignore what you're eating. Then there are some superfoods which are very good and will help you in pain relief, in subsiding inflammation from the joints, and also will give some temporary management of the pain. and at the same time they help in strengthening and nourishing your joints on a longer run. So in spices, turmeric, fenugreek, and dry ginger, it is very effective, and you can use regularly in your regular foods. You can also make a mixture of turmeric, fenugreek, and dry ginger, so in equal quantities, and half spoon from this mixture can be taken twice a day with warm water or with milk to help in relieving the pain. Some seeds which are good: flax seeds, sesame seeds, pumpkin seeds. So flax and sesame are also rich in omega-3 and rich in calcium and help in strengthening the joints. Some vegetables like moringa or drumstick, it is it's a super food for joint pain conditions and can be taken every day. Some green vegetables should be consumed regularly. Garlic is also can also be an important ingredient in your regular meals if you have joint pain, or you can also chew a clove of or chew or swallow a clove of garlic empty stomach every day. So it can be done with water or just with milk, as you like it. In dairy products, if you have a habit of taking milk and if you can digest milk, then milk is very good for joint strength. And ghee, cow ghee and cow milk I'm talking about. So cow ghee, if you can find Indian cow ghee, then it is even better, very good for your joints. Grains, red rice and millets are good. In nuts, walnut, almond, dates, and figs. So these four are very important and can be a regular part of your diet. Some herbal supplements like ashwagandha, shatavari, shallaki, guduchi, these can also be regularly taken for a longer period of time without any problem. These supplements can also be taken. So these are certain foods that you can make, that you can include in your diet and make a regular habit of taking them so that you can get a better and healthy joints. And at the same time, it will help you in relieving from existing joint pain conditions. Next slide, please. Okay, so thank you very much. And I hope you'll have some nice takeaways from this session. And if there are some questions, I think we can take the questions now. So there is first question, can Ayurveda cure joint pain completely, or it is effective for managing the symptoms only? Yes, the joint pain is completely cured in Ayurveda. It is not only about managing the symptoms, and the duration of treatment might vary from the chronicity of the disease and also the nature of the disease, but the cure is definitely complete. But as I mentioned, even after complete management, you will have to take care of the joints through your food, through some oiling, and through some natural supplements. So this is what is expected once the joint pain is cured. Are there any specific herbs or remedies that are particularly effective for treating joint pain? So I think I have discussed some herbs here. Those herbs can be taken regularly, and also some foods that I mentioned that can be taken. It is important to oil the joints regularly, and the mixture with the turmeric, fenugreek, and dry ginger powder. So this can also be taken as a remedy to manage your joint pain. But again, we have to look for a complete solution. The remedies or over-counter herbs will help you in for some temporary relief, but for a long-term complete cure, we should look for expert advice and a complete solution. Is Ayurvedic treatment safe for people with other health conditions or those taking prescription medications? Yes, of course. So Ayurveda is very safe. It is much safer than any other medicine system, right? So because it's all natural herbs, And also, if you are taking any prescription medicine, no problem. You can take Ayurveda along with those medicines. I guess usually we give a gap in between the dosages if needed. Otherwise, it's very safe. And a lot of people, they take Ayurveda along with their regular medicines. Next question, can Ayurveda help prevent joint pain from developing in the first place? Yeah, so Ayurveda always advocates preventive care first, and then they talk about cure. That's why I also started with some preventive management, that you have to first prevent that the joint pain doesn't happen. So for that, manage your weight, do a joint strengthening diet, take regular joint strengthening diet, which can include some nuts and some honey and some milk and ghee and other foods that I mentioned, and also regular oiling and regular exercise, good timely sleep also. So preventing and maintaining your health is not also an easy task. It requires some effort from your side. So maybe a dinacharya or daily routine where you put in another, put in around an hour or two to take care of your joint health or overall health is uh, is required in such cases. Are there any dietary changes or lifestyle adjustments that can help alleviate joint pain alongside Ayurvedic treatment? So I think I have dietary changes are very important, and lifestyle is also very important in Ayurveda. There is a saying in Ayurveda that if you are not following the recommended diet, then you don't need medicine, because the medicines won't be able to completely cure you. And at the same time, if you're not following if you're following the right diet, then you might not need any medicines, because the right diet itself will act as a medicine. So it's important we do give a complete diet plan to the patient, which have advices what to eat, what not to eat. So in this case, as I have already discussed, that foods which are cold, dry, packaged foods, and foods which are gassy, such food should be avoided. And you should take food which is unctuous, freshly prepared, and more in liquid form. At the same time, some foods that I have already discussed should be taken. And in lifestyle, be more active. Even if you have joint pain, try to move your body, stretch your muscles, do some joint rotation, and also from the expert, you can do some yoga exercises as well. And timely sleep is also important part of your lifestyle. Next question, are there any dietary changes, or I think this is done. Ayurveda be used as a complementary therapy alongside Western medicine for joint pain? Yes, of course. So you can definitely use it. So in Western medicine, there are very limited options when it comes to joint pain management. There could be some supplements or painkillers or anti-inflammatory steroids. Sometimes they use, or then surgeries. Okay, so but Ayurveda, as I said, has a more broader spectrum of joint pain management, and you can definitely use along with your Western medicine. How does Ayurveda approach joint pain differently from other alternative medicine practices? So, other alternative medicine practices, maybe if you, I don't know what practices you are mentioning. So, if it is homeopathy, Unani, or all these therapies, then all these practices, then it is very different from these practices, because of the variety of herbs that we are using, the personalization that we do in Ayurveda, and also the root cause based practices that are prevalent in Ayurveda. So these are the three things which sets Ayurveda completely different from all other practices. Is there any potential side effect or risks associated with? Not really, no risk, no side effects. So, uh, I mean, even if you take these herbs for a long time, so we have some autoimmune joint pain condition where a patient has to take medicines for a year or 2 years sometimes, but still they don't have any side effects. So there are no side effects. Of course, you have to take the right medicine from the expert. You cannot do self-medication, but when you're under the Ayurvedic supervision, there are no side effects. How long does it take to see results from Ayurvedic treatment from joint pain? You can see result within a week. And sometimes if there are the conditions are chronic and the nature of the disease is very severe and advanced stage, then it might take 2 to 3 months to see noticeable changes. But in most cases, within first 15-20 days, we see good improvement. Okay, so I think we have taken most of the questions. So is there any other question, any other query, anything else still if anyone has to ask?
Yes, thank you, Doctor. I think that's all the questions that we have for today. Thank you so much for taking this session. We really have a lot of gratitude towards you, and I'm pretty sure all of our listeners, our watchers for the day would obviously take back so much from this session. Thank you so much once again. Before we
Thank
end
you.
this session, I would like to remind you all, you can actually use our application. Let me just show you. So as I said, this session is brought to you by Alternative Health. So we are a platform. If you like this session and you want to get in touch with Dr. Chauhan, you can always go back to our website and you can register yourself. The registration link for our website would be app.alternative.health. So please do go on that platform and please do register yourself. We have a lot of specialists in alternative medicine, and truly even I personally believe that there is a lot of complications that comes with taking medicines chemically. But what doctors said, when we take care of our health personally and in natural ways, it's always helpful for us in the longer run. And that's what alternative health is all about, and that's what our mission is all about. So please do go visit our website. We have various specialists. If you would like to talk to Dr. Chauhan a little further, get a little bit more of consultation about your personal problems, please do register yourselves. And thank you so much, everybody who have joined today. Thank you so much, Dr. Chauhan, once again for taking time from your busy schedule. We really appreciate the session that you've taken and the time that you have taken to answer all of our viewers' questions. Thank you, everybody. I hope you have a wonderful weekend. Thank you. Thank you, Doctor.
Thank you. Namaste.